CHWs came into picture because we did not want to spend money on expensive healthcare services, including trained doctors or tertiary hospitals. And we saw that because low and middle income countries and low income countries did not have the capacity to spend or did not have the resources at the time when this community health came into picture, we wanted workers that could be slightly less trained than trained nurses and doctors, but they could also still reach to the communities where people can't really come that far and go to a hospital. And hospitals were not built at the time, and it's unfortunate to say that in a lot of countries, hospitals are still not there in rural areas, and you have to still walk very far. So that's the big gap that community health workers are filling. Now, if you remove them and put all of the money on nurses and doctors, how would you bridge that gap unless you have a facility which is so on point and there in the rural areas that it's actually delivering quality services? So community health workers are one of the most cost-effective service delivery models, and which is a recent research which has shown that they're the most cost-effective service delivery models, and you do not need to spend enough money, but you're getting so much in return. But needless to say that has actually made them become unpaid and they're volunteers, because we feel like, well, they're cost effective, so we don't need to spend on them. And that's why they end up being more volunteers than actually paid professionals. So yeah, I think that probably answers the question, that because they're cost effective and also that, yeah, they came into picture because we didn't want to spend so much.